I am going to be talking about prostate cancer today, and this presentation is directed at men ages 30 through 35. So the prostate is a walnut-sized gland below the bladder and in front of the rectum. The prostate secretes fluid that nourishes and protects sperm. It gets larger as men age. Prostate cancer begins when cells in the gland start to grow out of control. It usually starts as a nodule in the posterior portion of the prostate without symptoms. By the time symptoms are produced, cancer is in advanced stages. At this point, metastasis is common and most frequently in the pelvic, in lymph nodes, and bone. About prostate cancer, it's the second most common cancer among men behind skin cancer. Some prostate cancers spread quickly, but most grow very slowly. There have been many instances of men dying from other causes, and an autopsy shows cancer of the prostate that was never detected because there were no signs or symptoms. About 1 in 9 men will be diagnosed with prostate cancer. 1 in 41 men will die of prostate cancer. There are about 2.9 million men in the United States living with prostate cancer right now. Prevention of cancer. Preventing cancer consists of changes to lifestyle and breaking unhealthy habits. Reducing exposure to carcinogens, substances known to increase risk for developing cancer, is also important. You can eliminate smoking, eat a healthy diet, get plenty of fruits and vegetables, and exercise regularly. Risk factors for prostate cancer are race. African American men are twice as likely as Caucasian men to die from prostate cancer. Asian and Hispanic men are at the least risk. It is most common in North America and northwestern Europe and Australia. It's least common in South America and Asia. Having a father or a brother with prostate cancer more than doubles the risk of developing it, but prostate cancer is often found with no family history. Detection of prostate cancer is done by a blood test, the prostate-specific antigen. This isn't done without reason to suspect prostate cancer, though, because it may lead to finding and treating a cancer that never would have caused problems. The other way is a digital rectal exam. The doctor inserts a gloved finger into the rectum to feel the prostate. This starts usually at age 50. Start at age 45 if you have one risk factor, or age 40 if you have 2 or more risk factors. The clinical manifestations, so the signs and symptoms are related to urinary obstruction, but sometimes there's none at all. The most common early signs are frequent bloody or painful urination, difficulty controlling the bladder, erectile dysfunction, pain in the lower back, hips, or pelvis, but most signs and symptoms, like we talked about, develop in later stages. It also is sometimes accompanied with benign prostatic hyperplasia. You may be experiencing back pain or sciatica, complaints of dysuria like we talked about, and hematuria. The medical management depends on the stage of the cancer and the patient's age, but localized prostate cancer can be treated with radioactive seed implants placed directly in the prostate to spare the surrounding tissue. This is called brachytherapy. This is a one-time outpatient procedure. Patients are advised to avoid having children sit on their lap and avoid intercourse for 2 months after placement. A prostatectomy is also an option, and 3 goals of that are to remove the entire tumor, to preserve urine control, and maintain sexual function. If the disease is able to be controlled by radiation or hormones alone, the prostate may be removed. This is the most effective way of eradicating the tumor. The retropubic approach is the first choice, as it provides access to the pelvic lymph nodes and provides more urinary control. It's the best approach to avoid urinary incontinence and impotence. Radical prostatectomy involves removing the entire prostate, the true prostatic seminal vesicles, and a portion of the bladder neck. The prognosis is directly related to the extent of the disease process when it's diagnosed. Grading of the tumor correlates with the prognosis. More poorly differentiated, more poor the prognosis.